thank you for that very kind introduction, Rainu. So I grew up in the 1990s, and that is a decade that is sometimes called the holiday from history. It was an unusual period of peace and prosperity. It started with the fall of the Soviet Union and the rise of the internet. It ended with a balanced budget and the dulcet tones of the Backstreet Boys. Life was good. Now, what I took for granted then, and that I don't take for granted anymore, is that the reason that life was good, or the reason that it seemed that way to so many people, wasn't an accident. It wasn't just happenstance. It was the product of people and institutions who had worked for decades to make it that way. If that era felt uniquely optimistic, it was because through struggle and persuasion and compromise, America really had become a more open and inclusive society. In 1999, nearly 3/4 of Americans said that they were happy with the way that things were going. In 2025, 3/4 of Americans say that they're not. Now, a few years ago, I met a man named George. And George was born in 1950, not in a holiday from history, but very much in the thick of history. His parents had lived through the Great Depression. His dad had fought in the Second World War. When George was a teenager, Lyndon Johnson passed into law the Social Security Amendments of 1965, otherwise known as Medicare and Medicaid. The legislation commanded bipartisan support. It got votes from both Democrats and Republicans. And that doesn't mean that its passage was easy. The bill almost failed again and again and again. But in the end, it was evidence of a functioning political system. Now, George worked in a factory for nearly half a century. In every paycheck, there was a line. And that line showed a small deduction for Medicare. That line was both a deduction and an investment. Except that now, when George is in his 70s and he needs medical care for blood pressure, for diabetes, for cancer, that care that he needs increasingly feels like it's out of reach. There are Part B premiums, there are co-payments, there's deductibles. He needs Part D coverage, he needs supplemental coverage. To pay for all of it, George has had to start to skimp on rent and utilities and even food. And so he has spent a lifetime paying for the promise of care that now he can't afford. And George isn't alone. The average Medicare beneficiary spends more than $6,000 out of pocket every year. That's 40% of the Social Security income that the average person receives. More than 1 in every 5 Medicare beneficiaries say that they have had to delay or skip care because of the cost. Many people aren't filling their prescriptions because they are too expensive. And so a program that was created in the middle of the 20th century now urgently needs to be updated for the economic and the medical realities of the 21st. Stories like George's remind us that the details of policy matter, but so does the machinery that makes that policy possible. Because underneath every good policy is a functioning politics. And underneath every functioning politics are norms and institutions and people who make things work. Those are the traditions that animate a society in which progress is not just possible, but progress is sustainable. Because in the long run, strengthening Medicare, ensuring that older adults can live with dignity and security, that is not just a policy project, it's a civic project. Now, in their book, Why Nations Fail, the Nobel Prize-winning economists Daron Acemoglu and James Robinson, they argue that the secret to a nation's prosperity isn't its geography, it's not its culture, it's not its natural resources, it is its institutions. Successful nations have what are called inclusive institutions. They distribute power broadly. They encourage innovation. They allow diverse voices to be heard. And they have rules that ensure that their leaders are responsive to the needs of their people. By contrast, nations that are failing, that are struggling, they have extractive institutions. They concentrate wealth and opportunity. They weaponize the administrative state. They disempower citizens. They favor the few while marginalizing the many. So what sets one country on one path and another country on another path, it's not usually a white paper. It's not usually a strategic plan. It is a critical juncture, a moment of upheaval when the old order has fallen away and a new order has not yet taken shape. And we are living through a critical juncture today. Nothing feels settled. Everything feels like it's up for grabs. Today, aggressive gerrymandering means that politicians pick their voters instead of voters picking their politicians. Civility has given way to contempt. Watchdogs are fired without reason. Political opponents face prosecution. Every day seems to bring a fresh attack on freedom of speech and freedom of the press. Even the peaceful transfer of power is no longer a given. And that is what a transition from inclusive to extractive institutions looks like. Now, for a talk that started with the Backstreet Boys, we've wandered into some pretty dark territory. And it's hard to find hope in a moment like this, at least it is for me. And it can feel so overwhelming that it's easier to be passive than participatory. But I heard something recently that started to shift my perspective. And that was that hope is not the cause of action, hope is a consequence of action. Hope is not the cause of action, hope is a consequence of action. So when you see people acting, when they're doing something, when they're doing anything, that is contagious. It reminds you that to the extent that the moral arc of the universe bends towards justice, it is only because there are people who are working hard to bend it. People who use their time and their resources and their efforts to push forward, sometimes by a few miles, sometimes by a few inches. And that is what I find so inspiring about the Medicare Rights Center. Every day, it does the hard work of helping people who need it. In a world where hashtags count as activism, this is an organization that supports real people in the real world. Every year, it answers tens of thousands of questions from Medicare beneficiaries. It secures millions of dollars in benefits that people are entitled to. It helps people navigate a bewildering system. It leaves them feeling more supported, more secure, and less alone. I have heard from older adults who've told me that one phone call from the Medicare Rights Center has changed their lives. Now, in his classic book, Democracy in America, Alexis de Tocqueville warned of the path through which institutions in a country like ours could degrade. It wouldn't be through a violent overthrow. It would be through a slow suffocation in which leaders no longer feel responsible to the people that they are meant to serve. Tocqueville argued that what kept that from happening here in America were habits of the heart, the everyday engagement of citizens that sustains communities, institutions, and society as a whole. Now, there have always been periods in America when those habits have faded. And they have always been followed by periods in which those habits have been revived. And the work of the Medicare Rights Center is part of that revival. When we help people like George and the millions of people like him, we're not just strengthening Medicare, we are engaging in the civic work that sustains a democracy. When citizens act, when they turn the promise of policy into the reality of policy, they remind us that hope is not just something that we wait for. Hope is something that we have to create. Thank you.